Welcome to Season 2, Episode 8 of the Home Healthcare Today show. I am your host, Dr. Cleamon Moore. It's April. April is National Arab American Heritage Month. We have the distinct pleasure and opportunity to be joined today with the mayor of Hamtramck, Michigan, Mayor Amer Ghalib. The mayor has a bachelor's degree. The mayor is also a registered nurse and has been a civic and community leader for several years. But you don't just have to take my word for it. Mayor Ghalib, welcome to our show.
Thank you.
Do you mind sharing with our listeners and viewers a little bit more about your background?
Sure.
And what drove you to run for the office of mayor?
All right, so I just want to introduce myself shortly first.
Yes.
I came to the United States about 23 years ago. I was about 17, 18 years old when I came after I finished 11th grade in Yemen.
Yes.
And so I came here alone. My family was back home. I had to work in a factory 10 hours a day.
Yes.
And I went to high school, in Hamtramck High School. I finished my last year of high school there. And there's an interesting story about how I did it.
Mm-hmm.
It was a major turning point because I was about to stop going to school in the first 2 days because my friend told me, when here in America you go to school, you don't have to do homework. But he was talking about himself.
Right.
He wasn't doing homework. So
Right.
the first 2 days I was like, my goal is to learn English here. And the math teacher kept giving me zeros for 2 days. And then when he found that I have good math skills, he wrote some difficult problems on the board and I solved them. I was like, let me show him that I know my stuff. I just don't have time to do my homework because I work 10 hours a day.
Yes.
So he then had to talk to me after the class, and he was like, why don't you do your homework? I told him that I work 10 hours, and this is my last day of school because I can't do homework.
Right.
And then he convinced me to work 8 hours instead of 10,
Yes.
saying that it's not mandatory to work more than 8 hours. And then I had to punch out at 11, do my homework in the cafeteria, wait for the person to take me home. And I was able to finish my, he actually promoted me from that math class to higher classes because in Yemen I took calculus in high school, so I knew my stuff.
Yes.
And so that was the turning point. I was able to finish the high school. Then I went for pre-medicine. I started in Henry Ford Community College. Yes. Finished there with excellent performance.
Very nice.
GPA around 3.75.
Okay.
And then I transferred to Wayne State to finish my pre-medicine, biology, and bachelor in biology. Then I wasn't accepted in medical school here because of the MCAT distribution. English was low, science was high. So I got accepted in Rice University School of Medicine,
Yes.
which is an American medical school in the Caribbean, in Dominica.
Mm-hmm.
Did my first 2 years there. Finished my last 2 years, third and fourth year here, mostly in Sinai Grace Hospital. I did my rotations there, took my board exams, step 1 and step 2. I wasn't lucky to find a residency, so I started working under supervision of Dr. Hazem Samir in Hamtramck Medical Group.
Yes.
Like you said, I also have an accelerated degree in, I did an accelerated program in nursing that took me just 11 months to finish.
Very nice.
So I worked under supervision of Dr. Hazem Samir in Hamtramck Medical Group, serving the community in Hamtramck.
Yes.
I built a strong relationship with the people here. Mm-hmm. And that was the basis for my decision to run for the mayor, because I was almost confident that people like me in this community.
Yes.
I helped them so much. I do my best to help them. You know, you wouldn't believe it that some people will bring to me and one incident, one person brought the homeworks of his son to the clinic, saying, "Can you help me with this?"
Sure.
I was like, "Okay."
Was it math homework?
It wasn't math homework.
Very good.
And I told them, we don't just do medical services in our clinic, but we also do social services.
Very nice.
That we are not supposed to do, but we help people. Taking into consideration that a lot of them are immigrants, and they
Yes.
have difficulties with English, difficulties with learning and adapting to the new way of life. So we
Absolutely.
try to help those people,
Yes.
even if it's out of the scope of our work.
Yes.
So this is my story in short. I ran for a difficult campaign last year. I won the primary election as the front runner, and then the general election I won by 69.5%.
Yes.
And here we go. I'm the mayor of the city,
Yes,
which
you
is
are.
here. It's a part-time job. I continue to work in the clinic and serve the people as well.
Wonderful, man. Well, congratulations
Thank you
on,
so
on
much.
such a historic win, right?
Thank you.
And still being able to help people in the community, right?
Right.
I appreciate the social services aspect because when we think about health and wellness, we cannot avoid or ignore the other issues and challenges that folks in the community have, Mary. So appreciate that point. And that's the perfect segue to question 2 that I have for you. How do you balance those roles as a healthcare professional and as mayor part-time in terms of putting on the clinical hat and then taking it off and putting on the community leader hat?
Yeah. So this is a common question. It used to be
Yes.
thrown to me during the campaign. How
Yes.
would you be
Yes.
the mayor and you already committed full time?
Yep.
But the good thing is, yes, we work in a clinic that's very busy. It's very busy. We see
Yes.
up to 60, 70 patients a day.
Yes.
There's multiple doctors in there.
Mm-hmm.
And I have flexibility. That's the good part.
Okay.
So
Yes.
whenever I want to leave the clinic, it's okay. There are
Okay.
always people to cover for me. And whenever, it's that flexibility, you can't find it in a hospital or
No.
somewhere else.
Right.
You can't leave whenever you want, come back whenever you want. So this is the plus thing in my job. And I knew it will continue even if I become the mayor.
Yes.
And I know that the mayor's position here, it is a part-time job, but it's a full-time commitment.
Yes.
So I still have, it's not only to chair the meetings and you always have to meet the people, listen
Yes.
to them, respond to their questions, attend events and meetings everywhere.
Absolutely.
I so far I'm doing well.
Okay.
Yes, number of hours of my work in the clinic decreased, but I was expecting that. That's okay. And then there's more commitment after work.
Yes.
And we always have Friday, which is today, off.
Yes.
So this is a day when I do interviews like this.
Thank you, sir.
Unless somebody is flexible to come after work, then I do it. If there's an emergency or something important, like I said, it's okay for me to leave work, get it done, and come back to work.
Absolutely. Absolutely, Mayor.
So it's going well so far.
Okay. Mr. Mayor, granted that this is National Arab American History Month, and you certainly made history, who inspired you along the way? Because you're an inspiration to so many, and you started in your introduction about coming to the U.S. 23 years ago as an immigrant, working long hours, in a factory environment. I'm curious about who were some of the folks that inspired you along the way.
So, yes, this is the month of Arab American Heritage. We just passed a proclamation on that, from the city of Hamtramck to recognize this month as the Arab American Heritage Month.
Yes.
And this is something, the political, how do I say it? Politics in general is one of my hobbies since I was in high school,
Okay.
not only here. And there's a story that I mentioned in my inauguration speech, that when I finished my high school, one of my advisors called me and she looked at my grades and she found that I was, I brought my transcript from Yemen,
Yes.
besides the one I did here,
Mhm.
and she found that I was getting A's in calculus, physics, chemistry.
Yes.
And then when she asked me, what do you want to be? I told her I want to study politics. And she was surprised.
Yes.
She was like, politics? You are getting A's in science and
Yes.
calculus and physics, and you want to do politics? Why?
Yes.
She thought it's going to be a waste of time.
No.
I just said I love it. I mean,
Yes.
there are people who inspired me when I was a kid, including one of my uncles. He has a PhD in politics.
Yes.
And he was very active and well respected in the community. So
Yes.
I was hoping as a child that I want to be like him.
Absolutely.
I had to rethink my decision because he himself ended up here in America, my uncle.
Yes.
And he told me politics will not feed you. You have to find a profession. Like
Sure.
you have to
Yes.
study something that will, help you make living, whether you are in the U.S. or somewhere else.
Absolutely.
So I thought about what's my second favorite field, and I found that medicine was, because I used to love biology, chemistry,
Right.
physics. Math, I was good in it, but I don't like it. I mean, I'm good math skills, but I don't like it.
Sure. I get it.
Yeah. So I decided to do medicine, and I knew it would be long and tough
Sure.
and difficult. But while doing medicine, medical school, all the stress I went through, I was always following what's going on here and there, politics in the Middle East and here.
Yes.
And I found myself, if you look at my personal Facebook page, it's all about politics.
Sure.
Since 2011 until now, until people used to comment on me and say,
Yes.
I mean, write something about medicine. You always write about politics. So
Right.
it's something in me that
Yes.
I love. And I was observing the situation in Hamtramck, and I
Yes.
thought that we need a better representation for the
Absolutely.
city, and it's
Yes.
time for a change.
Yes.
And when I didn't see anybody to step up and
Right.
only the same people over and over,
Right.
which I have all the respect for them for stepping up to serve the community, but
Yes.
I thought that we needed some change.
Absolutely.
And that's when I took the difficult decision.
Yes.
I thought about it a lot. I knew it's going to be difficult and hard,
Yes.
but I took that decision,
Uh-huh.
and I faced all the challenges and all the discouragement from the people that I'm not well known, I'm not going to win, I don't have experience.
Right.
But
right.
I went through all that, difficult and tough campaign,
Yes.
and I made it.
Yeah, you did. Yes, sir. You did. You did, Mayor. Mayor, I think one of the things that stands out in my mind, and perhaps for our listeners and viewers of the show, there are some good intersections between social science of politics as well as some of the physical sciences, right? So I think the well-being and the participation that individuals have in a community does have an effect on health to an extent. So when you think about social determinants of health, right, you have to think about the community and the economic environment and jobs and safety and the like. So there's definitely intersections and view of access to health. So I think you being so well versed on the medical side helps to not only influence some of the outcomes for the political side, but it gives you a greater understanding, I think, of citizens. And you're able to see them not only as voters or workers or residents, but you're able to see them as human beings, by serving in the healthcare clinic and understanding how the body works and stress and diet and all of that. Which makes me think about the pandemic. You won. You won during the pandemic, right? What was that like in terms of educating individuals in the community about COVID, serving individuals in the clinic, right? Even educating when the vaccines became available and encouraging vaccination. So what was it like running during the pandemic?
It was difficult, you're right?
Yes.
Because we had to attend all these events, and we have to keep in mind that you have to be careful.
Yes.
Being a role model for the community,
Yes.
taking all the precautions and preventative measurements to educate the people. So,
Yes.
like you said, we in the medical field, after going through medical school, we were trained strictly on how to build relationships with the people, how to build rapport, how to communicate
Yes.
with the people.
Yes.
Not only that we were trained on how to communicate with professionals like doctors and nurses, and, lawyers and all that. But the main thing is how to build a trust between you and the patient.
Yes.
So I believe that helped me a lot because, I mean, I don't want to compliment myself, but I know that my patients are very loyal to me and they like me. They respect me. I like them too.
Yes.
And so that, whenever they come to the clinic, sometimes they have to see me to talk to me, even if they have nothing, even if they already seen by somebody else.
Yes.
They still want to see me and talk to me. Okay. So that was a sign that I am getting a lot of support in the community. Okay. And sometimes, you deal with the person not as a disease, but as a human being.
Yes.
And you use a holistic approach, like, talking to people, taking into consideration their not only their physical problems, but also their social problems, and the fact that a lot of them are immigrants in this community, and they need help with other stuff other than just getting medications and being sent home.
Yes.
So I treat people well.
Yes.
And I try to build a relationship with them. Over the past 7 years, never thought that I would be running, to be honest with you. So that the purpose of keeping a good relationship with the people wasn't for secondary gain, because I'm gonna run for something. It wasn't that. No. It was part of our job and ethical principles that we were trained on. Mm-hmm. So it paid off at the end. Yes. When I needed the people, they were there for me. Uh-huh. And so I would like to keep this good relationship with the people.
Yes, indeed.
Being a community servant leader by nature, as a healthcare professional, and now as a politician, I have to maintain a positive attitude with the people, indeed. Good relationships. I will still take care of their health in my job, and of their other needs outside of the job, social needs. So,
very nice, very nice. Mayor Ghalib, we're going to go to a commercial, but after the commercial, we're going to resume this wonderful conversation. So we'll be right back. Spring is a beautiful time in Detroit and Southeast Michigan. American Advantage Home Care brings that energy, joy, and vitality of the season right into your home, coupled with skilled home health care services. Our world-class team of clinicians can help you to thrive, maintain, and rebound in the comfort of your own home. Finding a home health care agency more compassionate and caring than American Advantage Home Care is a long shot. Welcome back to Season 2, Episode 8 of the Home Healthcare Today show. Yes, it is National Arab American Heritage Month, and we are in the City Hall of Hamtramck, Michigan, with the mayor. Yes, the mayor, Mr. Amer Ghalib. We're going to pick up from where we left off in that first segment. So, Mr. Mayor, when it comes to the city of Hamtramck, what are some of your hopes and top priorities for the health and the wellness of residents?
Well, as a healthcare professional, I always have, dreams that Hamtramck would host some major healthcare facilities and specialties, because when we work in the clinic, we have difficulties finding nearby places for specialists and for, to send people there. And like I mentioned to you, to improve the wellness and the health of the people, we have to have, regular screening tests for them. Yes. And that's difficult for some of them because they have to drive far.
Yes.
And transportation is an issue, especially for those newcomers, immigrants, like I told you. So if we have those major healthcare facilities in Hamtramck, they would have, they can walk to there, right? Yes. And they will keep up with their appointments.
Absolutely.
And we have hope that to get a better home healthcare
Sure.
services. Like I told you, we have a
Wonderful.
lot of people who are bedridden at home
Yes.
and they don't speak English.
Yes.
They need better services when you go to their house.
Yes.
If someone speak their language, that would be a plus.
Okay.
So that's another thing. So
Yes.
home health care services,
Yes, sir.
availability and access to them is another thing.
Yes.
Healthcare insurance are difficult for some people to find, especially the
Yes.
newcomers. And so to find an access, easier access for healthcare, that would bridge the gap in healthcare disparity,
Sure
that
would.
we have in here.
Yes.
So these are some of the issues that we will work on to improve the public health here, and the city will, will work on cleaning the environment, make it healthier, attractive to businesses to come to here.
Yes.
And like I said, doctors too,
Absolutely.
specialists to come to Hamtramck because we don't have many of them here,
Yes.
and we have to drive to other cities.
Absolutely.
So these are some of the stuff that I'm hoping to work on and to cooperate with different parties to make it possible.
Absolutely. Well, as President and CEO of American Advantage Home Care, Mr. Mayor, you could count on our agency, to assist. We do have multilingual and bilingual healthcare professionals, that as nurses as well as therapists. Are there any other needs outside of just general home health care, like our physical therapy offering or nursing or occupational therapy? Are there any specific offerings as a home health care agency that would be important for you as well as to the residents outside of the general breadth of home health care offerings?
Well, I think these are the major ones that we need,
Okay.
Physical, occupational therapy, speech
Yes.
therapy, wound care sometimes.
Mm-hmm.
And like I said, this will be, sometimes we need just education for the patients.
Yes.
If you can educate the patient about their diabetes, their chronic
Mhm.
diseases, or
Yes.
whatever at home, about their diet.
Yes.
And so that's the main thing. And if we get people who speak their language, that
Sure.
would be a plus.
Absolutely. Very good. Very good, Mayor. A couple more questions. I know we both have some competing priorities this afternoon. You've been so generous with your time. When I'm so glad to see that Hamtramck is open for business, it's welcoming, it's inviting and the like. And myself as a business prof and a former business school dean, I would like to encourage, business stakeholders as well as residents in other parts of Southeast Michigan to do business here, and of course to dine and to shop, right? How else could we, I guess, better engage or better make citizens of Southeast Michigan and even other areas aware of the happenings here in Hamtramck?
So as you know, Hamtramck is a small city, but
Yes.
we say the world is in 2.2 square miles.
Yes.
So we have diversity that you can't see in anywhere else.
Right.
In everything, not just in the population of the city, but also in the food,
Yep.
the markets, the different culture elements. So that's one thing for people to come and visit Hamtramck.
Yes.
Another thing is we are a very dense city,
Mm-hmm.
one of the most dense city in Michigan. So there's a promising future for businesses to flourish in Hamtramck.
Yes.
There were some streets that were dead a few years back. Now they
Yes.
are rebuilt because
Very
of the
nice.
new immigrants who came and invested in homes and businesses in here.
Yes.
So it is very vital and vibrant community here,
Very
and
good.
we ask people to come and visit. People who want to invest here, we'll try to help them and make it easy for them.
Wonderful.
And like I said, it's very promising
Yes, sir.
because people here, there's many different, a lot of stuff that you can succeed if you open your business here.
Mm-hmm.
Taking into consideration the diversity that we said here.
Yes, sir.
Anything will will succeed. Anything will be successful in this
This is
city.
good. This is
So we ask people to come, try the different foods we have here. Some Middle Eastern, Yemeni, Bengali, Bosnian,
good. Yes.
Polish,
Yep.
African American, all kinds of food that you need. In here.
Wonderful, Mayor. Yes, sir. Last question for you, Mayor. It's also Minority Health Month. Is there anything else that you would like to share about the urgent care clinic and its offerings, or about the city in general as we close?
Yes, we have good numbers of urgent cares in Hamtramck. Not all of them work well. There are some that are very busy, some are not.
Mm-hmm.
But my hope, and it's an idea, that we will have one day a medical complex here
Yes.
with all the specialties in one building. That's something that I'm working on.
Wonderful.
If you have, like I told you, a lot of
Yes.
people will skip their appointments and suffer at home because they can't go to their appointment. They don't
Yes.
have even somebody to help them with the appointment.
Right.
So if you have that medical complex in one place, urgent care here,
Yes.
specialties will come, orthopedic,
Yep.
OBGYN,
Yes.
GI, general surgery. Each one will come one day to that place.
Yes.
So see the patient here, refer him to next door.
Absolutely.
That's something that will solve a lot of problems, improve health of the people and wellness in the city,
Mhm.
and make it easier for the patients to follow up with their appointments.
Absolutely. Very good. Very good. Well, you know what, Mayor Amer Ghalib, this has been an honor to meet you. Definitely we celebrated your win last fall. We saw the headlines, saw the television appearances, but meeting you and having a conversation with you face to face is certainly a true joy. I do know that you are making your place in history, and your contributions and your success, not only as an immigrant or Arab American, your contributions and success lead others of various races and backgrounds and inspires so many. So thank you, sir. Thank you for your time.
Thank you so much. Thank you for visiting us to
Yes.
Hamtramck, and I hope you enjoy your visit here.
Oh, yes.
And you are welcome to visit us anytime.
My pleasure. My pleasure.
Thank you so much.
Thank you, Mr.
Thank
Mayor.
you.